It's important for the Congress, in my view, to assert its authority in this space because it's given to them. It is unique to them in that regard. So you have that piece. But it also, I think, will continue to point up some of the tensions within the Republican caucus itself. And so I would, out of the gate, say for those 32 Republicans, thank you. It's not a bad thing. So all the crap and the BS that gets thrown at them for signing the letter, just check that. Because the reality of it is, this is the process of making good legislation, you know, for the people. And you may agree or disagree with the bill itself, but the process does matter. And so I'm encouraged by that, and we'll get to talk a little bit more on it, but I just think it's important right now.
So let's talk about the process and about your priorities. You're one of the signatories on this letter. If your priority is not adding to the deficit, what then would you want to see cut from this bill?
Well, it's actually, thank you for having me. Surprisingly enough, I have much more common talking on the Senate than I thought at the start of the conversation, because we definitely agree that Congress really abandoned its job. It's sadly enough, regardless who's president. And this is my third term, and I used to be state senate, and it really breaks my heart to see what's happening. But unfortunately, there is no bipartisanship in Congress anymore, and a lot of the issues are tough. But if we don't put our country on sustainable fiscal path, we are going to not be able to survive as a country.
So what do you want to see cut?
Well, if you look at that spending, you know, we have to really, I mean, if you think our spending before COVID was $4.5 trillion, we move it to $7 trillion per year, $2.5 trillion, and majority of it attributable to healthcare. And healthcare didn't get better. Americans still go bankrupt. We have lots of, profits made on Wall Street, hospitals built in Taj Mahal, executives make a lot of money. We saw all of the fraud in the insurance industry happening, and people are pretty much getting screwed, and federal government going bankrupt, states are going bankrupt. So we need to start looking how we can make sure that healthcare can be affordable, but come after true fraud, which used to be a bipartisan issue.
Explain to me, though, how a cut to Medicaid gets healthcare to a place where it's more affordable. Well,
listen, it's not cut to. We are talking about actually something that Vice President Biden at the time was calling a scam, where states, when Medicaid originally were planned, states were supposed to have skin in the game. They were partner to the federal government, to help the most vulnerable people. But unfortunately, they hired a lot of consultants, and I'm a CPA, I used to be in Big Four business. Like, they had very smart CPAs and consultants they hired who helped them to pretty much money launder federal government. They used provided taxes to do the match, so the states don't have to actually do their share. And on top of it, now they charge in Medicaid at the private level rates 3 times more than Medicare. So they cut in services for people with disability, but making a lot of money on Medicaid. Look at insurance companies, their profits. So look at what's happening.
Well, the insurance companies definitely need to be reined in and held accountable. And I think some of that did happen in the Biden administration, allowing Medicare to negotiate drug prices. I guess a lot of people have questions about Medicaid specifically because it is something that touches almost every single person around this country. In Indiana specifically, here's some of the stats. 1.8 million people are enrolled in Indiana in Medicaid. It covers 1 in 6 adults ages 19 to 64, covers 3 in 8 children, covers 2 in 3 nursing home residents, covers 41% of births. Would you vote for a bill that has any cuts to Medicaid?
No, we tried to improve it. Actually, Indiana just recently, and our liberal newspaper had articles, $3.5 billion was stolen of Medicaid by nursing homes, by hospital building Taj Mahals and stealing from seniors. But actually, that was Biden rule that allowed now upcharge federal government for Medicaid at the private insurance rate and cut services. And since Congress doesn't look at spending, they directly just funnel money from the federal government. So we actually want to make sure that Medicaid is better for the people that it's intended to, and then let's think how the rest of it is going to work, how we can make health care more affordable. And that is something executive order. I mean, President Trump doesn't get a lot of credit for it, but his executive order on price transparency in February can really change the dynamics, and I think that should be a bipartisan issue. But unfortunately, machine here is very powerful with money and a tax.
I think one of the interesting aspects of the Medicaid discussion that, as I said at the beginning, sort of will translate into how within the Republican caucus the members look at what a cut is. and what it is you are cutting. And so right now there is a discussion about what is a benefit cut. And it's a very interesting reporting that, basically if you ask most people, when you talk about a cut in benefits, it would be a cut in the benefit I receive from the program, right? So it's either, some type of medical service or other benefit that I get through Medicaid, which, again, for the record, is not just for the poor. It's also for those with disabilities. It's also for a lot of our veterans are on Medicaid for a variety of reasons. So it is a very complex issue. But the benefit cut question for me is an intriguing one. You had Senator Josh Hawley of Missouri saying lowering the federal match to states and imposing per capita caps may well be benefit cuts, right? Leaving Missouri with a choice of slashing programs, raising taxes, or throwing residents off Medicaid. If so, he's not voting for that. But then you have Chip Roy from Texas saying that the aggregate Medicaid spending is likely to rise in the long term, even if those restrictions are implemented. Therefore, it should not be construed as a cut. I align myself with Josh Hawley because at the end of the day, if you're capping benefits, right, or if you are otherwise redefining what those services are, you're directly impacting what each one of those beneficiaries is going to receive. Yeah. How do you see the question of benefit cuts? And it really kind of aligns to what Alicia was asking. How do you define it like Josh Hawley, or are you defining it like Chip Roy?
Oh, listen, I'll tell you, we're actually not cutting benefits at all, because the problem is the benefits are very low. The providers pay very little. What is happening on top? Insurance and hospital making money on top, and they building Taj Mahals, defrauding Medicaid, taking money from nursing homes and pay salaries to CEOs. So we actually so let me tell you an example. And there is a lot of reforms need to happen on Obamacare. If we move Medicaid recipients to Obamacare, which is actually, has some problems too, but it saves us $500 billion and gives better services than Medicaid. That's how corrupt and Medicaid became.
But I guess but you're talking about changing Medicaid. I guess when you talk to people in your district, and I know you had a town hall that was widely reported and talked about, and I know in the aftermath of that town hall, you noted that you said that some of the people there were paid protesters. We looked at some of the local coverage, read some of the local stories. I mean, local people care a lot about what's happening with Medicaid in your district, but all throughout the state in Indiana. And also they care about the tariff impact. We're going to get to that in a second. But what we really want to know is, are you able to tell us yes or no if you would vote for a bill that cuts any cuts to Medicaid? Because Josh Hawley is saying, I'm not voting for a bill that imposes per capita caps.
So if you're
Chip
imposing
Roy is saying,
he's saying that, oh, no, on the other side of imposing those caps, there's going to be a growth in the program. Therefore, it's not a cut, which is, in my view, BS, because you have to cut the program in order for that growth to come on the other side of it.
So which camp are you in? Or are you in a third camp that says, well, I want to cut something else?
No, I'll tell you something. Actually, I didn't say we had paid protests. I said organized by Democrat Party, but that's politics. That's fine. Makes us stronger, so it's okay. I just think hopefully we'll have a civil conversation at some point, and hopefully, and some people actually were very nice, and at the end of town hall actually came and talked to me. So not everyone was there just for a reason to scream. But I'll tell you something, that I am looking how we're going to fix healthcare and make it affordable for the people. So I want to make benefits better. So we need to look how we can make Medicaid better for the most vulnerable, for people with disability. And then what are we going to do? But right now, people getting overcharged. So I want to come after frauds that allows these monopolies, insurance, pharma, PBMs, hospitals, overbill everyone. I mean, make people go bankrupt, make a lot of money, make federal government go bankrupt, states go bankrupt, individuals go bankrupt, employers' insurance doubling. So we need to be able for that market to function. So we need to, because we cannot afford anything. Medicare, look at Medicare Advantage, look at site neutrality, overbilling by hospital and controlling physicians. So the market is broken. So I came to this country with one suitcase, and I had to work crazy hours to be able to afford to have my children. I had no insurance and had surprise bill that, was very significant. significant, and that could at that time it was a lot of money for me that I could barely afford. So I understand where healthcare, how corrupt it became, and we're getting subsidized it, and all of this lobbying groups spending a ton of money attacking with lies. So I want to make sure that we make Medicaid better for people that intended, force the state to do a better job because they're complaining. But right now, since they don't have skin in the game and can make money, they're not serving their people better. But then let's how we can make for the rest of the people more affordable and more better value in health care.
I want to ask you a political question. So you originally were not going to run for re-election. You are now running for re-election. Is that correct?
Well, we'll see.
She's still working it out.
But I feel bad, I'll be honest with you. This is a great honor, but, I get so frustrated with this place because this place has to govern. We have to be able to deliver and not to be afraid to challenge special interest group. And healthcare and this bill is a good example how everyone is afraid because a lot of money are spent and lies. And I think, unfortunately, we'll not be able to even talk to each other anymore.
Well, that's one dynamic.